This is most important, doctor. Removing supercoils is the function of topoisomerase. Unwinding is the function of helicase. Stabilizing that unwound template strands is the function of single strand binding proteins. एक बार for replication DNA double strand is unwounded, it need to remain in an unwound state, and that is maintained by the single strand binding proteins. Before the DNA replication occur on the lagging strand, leading strand, lagging strand, two things. Remember doctor, DNA replication, we all ignore it in MBBS first year, but most high yielding topic when it comes to entrance exam, definitely one question, DNA, RNA, different types of RNA polymerases, everything you should review. It's all there in our video library. So synthesis of the RNA primer is a function of primase. Leading strand is made to expand, even lagging strand, it is a DNA polymerase 3. Removal of the RNA primer and replacement of RNA with DNA is a function of 5-exonuclease activity of the DNA polymerase 1, and joining the Okazaki fragments on the lagging strand is the function of the DNA ligase, is what you need to ultimately remember. So doctor, which codon initiates the start of protein synthesis? AUG. How will you remember? AUG inaugurates. AUG inaugurates. Spelling of inaugurates में क्या है? IN AUG RATES, no, inaugurates the initiation of the protein synthesis is what you need to basically remember. Then what are the stop codons? You go away, you are going, you are away. So UAA, UGA, UAG, say that stop codon. So now doctor, IgM is responsible for primary response, G is IgG is responsible for secondary. Humoral immunity, typically it is the B cells, plasma cells which produce the antibodies, is what you need to remember. Type 3 hypersensitivity is the immune complex deposition. So there is a reason, it is the Arthur's reaction. Serum sickness, they are all type 3 hypersensitivity. Chediak-Higashi is an autosomal recessive disorder, and basically there is an impaired lysis of the bacteria in case of the Chediak-Higashi, is what you need to remember. So chronic granulomatous disease, Chediak-Higashi, Job syndrome, totally 6 immune complex primary immune deficiency disorders. Favorite question of the examiner, microbiology textbook mein 2 pages it will be, you have to read. Now, which immunoglobulin in anaphylaxis, doctor? IgE is the one. And type 2 hypersensitivity is a drug induced hemolysis or drug induced thrombocytopenia. Difference between type 2 and 3 is what? Antigen free, antibody free, both of them form immune complexes, is called type 3. Antigen is fixed but antibody is free and it goes and attacks the antigen, as in good pasture syndrome, where fixed antigen is which one? Glomerular basement membrane, antigen is what you need to remember. Which will show a non-linear elimination pharmacokinetics, all of them, but not ceftazidime. Aspirin, phenytoin, ethanol, they all show non-linear dose dependent elimination process. So you must always know zero order, pseudo zero order, first order. Pharmacokinetics is one chapter we ignore, but it has a lot of exam deciding questions. What is maintenance dose, loading dose? Loading dose कब देते हैं आप, maintenance कब देते? So volume of distribution, bioavailability, what are the formulae, everything you should master. Enterohepatic circulation, Estrogen is the one which will undergo enterohepatic circulation. Very few drugs undergo. Then rectal route, you can give indomethacin, metronidazole and diazepam. So rectal sulfasalazine is used for its local effect. Sulfasalazine is there? No, it is for the local effect, not for systemic effect. Whereas the other drugs are given, but they become absorbed rectally and ultimately they will show the systemic effect. Now, which drug in the P450 system of the hepatic smooth endoplasmic reticulum is a very important question. Metoprolol among the beta blockers. Levodopa, there is a peripheral decarboxylation and central decarboxylation, ultimately leading to formation of dopamine. MAO inhibitor metabolizes the tyramine. Suxamethonium is by cholinesterase and metoprolol is by the P450 system. Is what you need to appreciate. Hepatic acetylation is a feature which you see with isoniazid, hydralazine, dapsone. Accordingly, people are divided into what are the pharmacogenetics, slow acetylators and fast acetylators, and will drug adverse effect occur or not depends on what type of acetylator is your patient. Then for predicting the return of the renal function in a tumor lysis syndrome, what is the best parameter you need to follow? Can you tell me which malignancy notorious to lead to development of tumor lysis syndrome, doctor? APML, acute promyelocytic leukemia, is there? No? Spontaneous breakdown of the tumor cells will release the intracellular contents. Phosphate is intracellular or extracellular? Intracellular. Potassium is intracellular or extracellular? Intracellular. Hyperkalemia, hyperphosphatemia, hypocalcemia, hyperuricemia. The combination which is called tumor lysis syndrome. APML, notorious to lead to development of tumor lysis syndrome. So you will follow uric acid levels in order to know whether the patient is recovering or not, is what you need to understand. SLE, the most common cause of death is not cardiac. It is in the hands of nephrologist that the SLE patient will die. It is the lupus nephritis, which is the major cause of mortality, morbidity in case of the SLE, is what you need to understand. Where do you see autoimmune hemolytic anemia? CLL. What is another classical feature on the peripheral smear if there is a CLL? Smudge cells are the ones. Whenever you prepare smear, you get a broken out lymphocyte, is smudge cell. Mature looking lymphocytes in the peripheral smear, where do you see? CLL. Elderly man, CLL. Nothing need to be done, you can leave it without doing anything, CLL. So there are some specialities of CLL which you need to be quite sure on. Cavitation is a feature of secondary TB. Lymphadenopathy is a feature of the primary TB, is what you need to understand. Now Whipple's disease, Tropharema whippli. Typically macrophages which are containing large quantities of partially digested bacteria of Tropharema whippli is a special feature of Whipple's disease, is what you need to know. Whipple's celiac disease, tuberculosis of the intestine, close differential diagnosis to one another. You must know how to differentiate these three: celiac disease, Whipple's and TB of intestine. So if you did not read till now, read it at least now. If you take November exam, 100 days, too much time. If you take APPG, state PG, अभी क्या है अगस्त है ना, अभी स्वतंत्र दिवस हो गया ना, कम से कम रिपब्लिक डे तक कॉन्फिडेंस आ जाना, हाँ नहीं तो नेक्स्ट दिवाली तक वेट करना पड़ता। तो अगस्त, सितंबर, अक्टूबर, नवंबर, दिसंबर, जनवरी, फरवरी, 2 months doctor, lot of Sundays we are going to waste your time and our time, huh? So you can read a lot, keep building up the confidence every week, pick up some 10, 15, 20 topics on every Sunday evening, finish up all issues about it. Over a period of 20 Sundays you will do magic. Very easy to crack entrance exam, provided you know what to read. Quickly correct yourself. Quickly correct yourself. Day before yesterday, I was in meeting with one IAS officer. He is a top clan in the, he is like a health secretary. He told, it went offline, sir.